hygiene. I'm going to be your nurse today. Can I get your name and your date of birth?
My name is Shirley Templewood, 18. 10.
Okay. Alright, so we're just going to be assessing you postpartum and making sure that everything's going good. Are you in any pain right now?
I have a 2 out of 10.
Okay, you'd rate your name or your pain on a 2. Okay. Well, we're going to go ahead and get your temperature and get some of your vital signs, okay?
Okay, thank you.
Beep. Alright, 98.1. That's very good. Just going to be listening to your heart now for a sec. I'm going to listen for a full minute to get her heart rate. Alright, heart rate was 65, and I'm listening to breath sounds. Equal, bilaterally. No abnormalities there. Her respiratory rate was 16, and her blood pressure here. We'll pump that up. And blood pressure is 120/80. Alright, good. So now I'm just going to be, I'm going to go ahead and listen to your bowel sounds too. When was the last time you had a bowel movement?
I had a bowel movement 2 hours ago.
Oh, good. Okay. So if you ever have difficulties going to the bathroom or you notice that you're having some pains or anything like that, getting up and moving will really help you get your like intestines going and stuff like that. So just making sure that you're up and walking would definitely help. Have you passed gas recently at all?
Yes.
Okay, great. We're going to go ahead and give you a listen here. Good. Alright, bowel sounds are active, all 4 quadrants. So that looks good. Alright, so are you breastfeeding?
I am.
Oh, good, okay. I'm going to go ahead and get some gloves on. And we're just going to be palpating your breast a little bit. Have you noticed any like warmth or any tenderness in your breast?
No.
Any like nipple discharge or anything like that?
Nope, just breast milk.
Okay, good. Alright, so I'm feeling in a circular motion around her breast, and the breasts are soft. They don't seem tender. I don't see any facial grimacing or anything like that. The nipples are intact. And there's no discharge. So good. So you are breastfeeding. That's awesome. And your baby gets a lot of natural like antibodies, especially in that first breast milk. The colostrum is what it's called. And so making sure that you understand that your baby's belly is only about the size, or the stomach is only the size of a grape. So they're really not going to be eating as much in the first couple of days, but as they get older, you're going to obviously see a greater increase in their stomach size, and they'll be eating a lot more. I mean, they should be eating about like every 2 or so hours. It's not abnormal for that. So that's good.
Thank you.
Yeah. Okay, so we'll go ahead and go down to your uterus here. Just making sure we'll check this out a little bit.
I just peed, so this is good.
Oh, good. That's awesome. So you voided just like a couple minutes ago?
Yep, right before you came in.
Oh, that's great. Okay, good. So now I'm just going to be assessing your fundus in your uterus. So I'm going to be using a 2-handed technique, and I'm going to press right about at the umbilicus, and going to be using this other hand to stir your uterus down here, okay? Good. The uterus is firm. It's midline, and it's about 2 finger lengths from the umbilicus. So that's positioning is good. We don't want any boggy uteruses or anything like that. So when you urinate, do you have any pain or discomfort, any burning sensation?
No.
Oh, good. Okay, so if you do start to feel like that burning sensation, if you've ever had a UTI before, that can kind of be an indicator for that. So you want to make sure that you're just keeping an eye out for that, because infection is at high risk because you're so, you may have had like a laceration or hemorrhoids or anything like that. So we'll go ahead and assess your perineum for that.
Thank you.
All right, we're gonna go ahead and get some gloves on here. Did you tear when you were giving birth?
I think they said that I did.
Okay, we'll go ahead and check it out. All right, I'm gonna have you roll to that side rail here. I'm gonna uncover you a little bit. We'll go ahead and roll you. Ready, 1, 2, 3. Good. All right. So I don't see any redness or swelling. I don't see any bruising around the perineum. I don't see any discharge, and the wound is well approximated. There's 2 stitches back here, which is good. Awesome. And I didn't notice any hemorrhoids, which is good as well. So good, looks like you're doing well down there, so that's awesome. And I did see your epidural site, and that looked intact and well as well. So the next thing we're going to assess you for is some DVTs, which stands for deep venous thrombosis. And this is basically telling us how well you're getting up and walking around, if you're at risk for a clot dislodging and potentially going somewhere where we don't want it to go. So we're going to go ahead and look at your legs here. I'm looking for swelling that's unilateral. Do you have any calf pain at all?
No.
Okay. All right, good. There's no calf pain. I don't notice any warmth or edema necessarily unilateral, and both sides look really good. Awesome. Okay, so I did see, I think there's an IV site on this side, on this arm. IV site is intact. There's no erythema. There's no infiltration. I don't notice anything abnormal about the IV site. If the patient were to need to be bladder scanned, if she hadn't urinated in the past couple of hours or so, I would bladder scan her and make sure that her bladder wasn't full and she wasn't retaining urine. So bladder scanner, and once the Foley is inserted, I would definitely be doing cath care. I would be looking for signs and symptoms of a CAUTI, catheter-associated urinary tract infection, and making sure that the patient is urinating and getting rid of all those extra fluids that she got during her pregnancy and during the labor process. Also, the wound dressing on the back looks good, but we still need to check out her discharge, her vaginal discharge, which I saved for last because of how invasive it was. So we're gonna go ahead and look at your pad. So when was the last time that you changed your pad?
I changed my pad an hour ago.
Oh, good, okay. So I do assess the bleeding down there based on how much it's been and how long has she gone to change the pad. So if the pad had been 2 hours after changing, then I would cut the discharge in half. So we're gonna go ahead and look at your pad here. All right, I'm seeing some lochia rubra, which occurs 1 to 2 days after labor, and it looks about moderate because she changed her pad about last hour. So I'm going to go ahead and teach you about your discharges, down vaginal discharge. So it's going to start as lochia rubra, which is bright red, and that occurs for about 1 to 2 days after labor. And then you'll notice that this comes to more of a pink tinge. It's more pinkish, it's lighter color than what you noticed in the first few hours, and that's called lochia serosa. And then the last stage is going to be lochia alba, so do not worry if this happens for about 2 to 8 weeks after labor. So making sure that that's not too abnormal. You don't need to worry about that. And I didn't notice any big clots down there when I was assessing your lochia. But if you were to find like a big, like about golf-sized ball clot, that it would be super. You would want to let your physician know about that. I also didn't notice any like offensive odor at all, which is good as well. You really don't want anything foul smelling. So yeah, Other than that, your dressing on the back, I think I already talked about. It was intact. There was no redness, edema, anything like that. It was intact. So yeah, do you have any questions?
No, thank you so much. I'm really tired. I think I want to nap.
Okay, great. I'm gonna go ahead and let you nap here, and we'll go ahead and nap. So the next thing I also want to make sure I state is the patient during the assessment was very happy and attentive to what I was asking her. So she seems well accommodated here at the hospital. She seems like she's enjoying her stay, and she doesn't feel uncomfortable. Everything seemed like she wasn't anxious, so her emotional state was very good.